Editing. Okay, thank you. Thank you. So now the second part, can we play the second videos, please? Is some controllers back? Okay, so we have second patients. We try to play that. Okay, yeah. We have a lot of problem with the technical stuff. Okay, it's coming. Thank you.
I've also suffered from a lot of back problems over the years, with a combination of injuries and sort of rheumatic, arthritic problems. It's difficult to sort of, I mean, those are more kind of subtle effects, and it's difficult to evaluate those, but the physical results have certainly been, you know, quite profound, really. I definitely felt some physical benefits, and I suspect some possibly kind of emotional and psychological changes and beneficial changes. Well, I've actually suffered a lot less pain, back pain. I had quite severe back pain prior to coming here, which sometimes was worse than others. But since doing Qigong, that does seem to have subsided quite a lot.
Okay, good, thank you. Can we give me back the picture so we can talk through the picture? Okay, yeah. Now, so this gentleman, you can see that his movement is quite interesting in a way that, yeah, next picture, please. You can see the way that he was reacting now. Here, obviously, I'm using the energy point to, you know, to pump, well, what we call energizing, okay? Or I used to use the word zap. There's like a zapping people, you know, with the source of energy. Okay, so after that, the body reacts. So slowly, observe how he reacts. And at that point, I have to make diagnosis because he move in a way that they show us the 5 animals. So in the part 3, I'm using the 5 animals. The third patient had more obvious 5 animal coming out. Okay, so this is how we look at the internal Taoist medicine. Next picture, please. Okay, now, so I'm energizing him now because I can touch or without touching. So this is why a lot of people think that it's fake. Now, obviously, we don't have a machine. If we have a machine now, with that technology, I'm sure you can register some of the energy, the frequency, because it's quantum, isn't it? It's all quantums. Okay, yeah. You can actually measure it, you can actually see it, but obviously we cannot see it. We don't have that kind of technology, but so we have to rely on the patient's reactions. Next picture, please. Okay, now what I want to say here is nitrogen bubbles. Now, so we're talking about these arthritis, rheumatism. From my experience, 28 years of clinical case study, I'll use this as a biochemical blockages. Okay, yeah. Now, in a minute, I will also talk about the now, obviously, when you talk about this kind of blockages, people will not really understand. But if I give you a very, very powerful example, okay, the third patient, you can actually see the convulsions, very powerful. It is just like the diver's bend, right? The diver's bend. So just in case, you know, you don't know what the diver's bend is, okay, I'm telling you, these divers, when they go deep sea diving, now they have to take time to decompress, right? The oxygen in the blood slowly coming up forward. coming up to the surfaces, right? To the surfaces, and you take time. But if you go up too fast, all the nitrogens in the blood will form bubbles, right? And then actually the bubble blockages now. So this is why I'm using this bubble blockages on all the joint, because now there's biochemical blockages, and you can see the curled up or this bend. Now, tissue of your joint normally make, all the synovial fluid, right? The lubricator. Okay, so, and then the bubble nitrogen component of this fluid can form in your joint. So this is how I'm relating arthritis or rheumatism, because mostly it's the joint that got problems. So if a bubble form in there, especially the nitrogens, you will have a lot of pain, because it's actually the pressurizing of that bubble will push all your neurological, all your nerve ending, the fiber ending. Of course, you will have all the sensation coming out. Okay, yeah. So that's why I try to relay that from my obviously experience, or other, like I said, other doctors, other physicians, they have their own, case study. But from my point of view, from as an internal Taoist, medicine physicians, doctors, okay, yeah, that's how I share with you in my successful case in arthritis rheumatism. Next picture, please. And they always make some popping sounds. Okay, yeah. So now come to something now like this. Right, all this. And a lot of the other doctors said to me, said, hey, don't do that. You're going to have arthritis when you get old. Do I look like I have arthritis to you? I'm 70 now. Okay. Actually, it's completely the opposite. Because when what happened is when we're exercising, now this is muscular now, it's coming to the musculoskeletal side now. Okay. Now, so I'll come to it a bit later, but let's come back to this patient. You can see her now, he's just now, really like very uncomfortable. When I was talking to him, I said, and it's itchy. It's like millions of ants really, really crawling all over the body, and they want to shake it out. And it's gone into, actually, it's a spasm of the hands. Yeah. So you can see his expressions. Okay. Yeah. Next picture, please. Now, this is very, Professor. Thank you. So these are the nitrogen bubbles in the, in all the sort of popping sound you saw. Okay, because once you popped it, it's gone back into the bloodstream, and that's why, the depressurizing is like the diver's bend. So we can connect through that part. Okay. Now, don't forget, I never use any medications on these patients. Okay, this is the differences. This is a self-healing thing, because I don't use herbs, I don't use needles. Okay, I use energy point. So that means I trigger the patient, the body start changing, the body start regulating. Okay, yeah, so this is the major difference you have to take notes. Next picture, please. Okay, now, why I select this frame is because you can see his finger there, especially his thumb. Now, is the spasm on the thumb and the rest of the finger, but the thumb is so obvious. Now, you can see that's why when I observe that in that particular seconds and the sound he made, he's gone into the animals of the tiger. And that's why you can see I'm working on it from his back, right? Right, I'm energizing or sending energy to his lung at the back. So obviously these are technical things. I can't teach you in 1 hour, okay? But that's how we can actually relate into why this convulsion, spasm, right? And all the contraction of muscle happen, okay? Yeah. And when it happens, I mean, it's affecting all the joints. And that's why when all the joints are moving around, blood circulation resume, it unblocked it. You unblock all the biochemical blockages is gone. Musculoskeletal blockages is also balanced, and then neurological, blockages is also diminished. So patient felt better. Okay, next picture, please. Now, do you choose these pictures because obviously, very, very clear, these research fellows, they're talking about, they're suggesting there's the bubble formed right in between all these bones and joints and things. Okay, next picture, please. Okay, now, okay, right, let's do another few minutes. So symptom of the bends, that's why I just suggested now, I'm using the diver's bend here. Okay, yeah, and especially when we talking about now in the middle of the sentences, I don't need to read it all out, right? It will be in Facebook. You guys can look on the Facebook and look at it. Now, the musculoskeletal system, that's why I'm using this. So exactly what these medical journalists was talking about as well, right? Yeah, so these research fellows, so that's why I'm talking, and I'm using other, scientists and other research fellows, and they comment to try to connect each other. So it's a pain in around all the major joints, shoulders, elbow, right? Yeah, commonly affected in divers. Yeah. So, but any joint can be involved due to nitrogen being released into the joint and muscle. So this is why I look at these cases as the nitrogen. So the popping of the nitrogens, and obviously the fatigues, and all, especially now further down is the skin. That's why the patient you can see him really like itchy all over the place, the entire body, the entire skin. And don't forget, the entire skin, right? The skin is the biggest breathing apparatus, not our lung. Our skin breathes, and from the internal down, we have embryonic breathing skill, right? So therefore, another very speciality comes in, yeah? So by looking at the patient reaction, I can roughly tell you, right? Obviously, in this particular place, that second when he was really the thumb as well, and I know that his lung was affecting by, so the arthritis and all the rheumatism at that time is actually the symptoms, but the source of the problem, right, could be the lungs. But obviously I have to take the pulse as well, the different method of taking the pulse from the internal Taoist medicine. Okay, yeah, next picture please. And we have to, I have to use 5 elements, all kind of different theory to make diagnosis. Okay, now we're talking about the itchy just now, also known as the creeps. Okay, yeah. So I'm not going to read it all out now. So you lock on it later. Okay, yeah, you have a look at it. Now, so at the end of the day, right? So a lot of the symptom has been described, right, from these Western medicines research, and I capture it on films for 28 years, right? And also using the ancient literature, right? Taoist medicine. Don't forget, actually, this self-healing thing is dating back a long time ago. I gave him one lecture. We still have to rely on archaeological diggings, because at the end of the day, we can talk about it, but we have to have some proof in the university. So I've been looking at archaeological diggings of Professor Jia, right? One of my supervisor. And he got digging out and dating back the Chinese, shall we say, the Chinese starter of spiritualism. Now, because these things are like spirit, right? They're possessions. So I can only relate to that. The Chinese Qigong, which is spontaneous Qigong, like a spiritual healing, okay, started in China 18,000 years ago. 18,000 years ago. That's where the Chinese spiritualism ceremony, because it's mostly ceremony taking place. I've spoken about it. Look in the video library. Okay, so this is why it's very important that we have to use, right, modern science to try to identify, and then to analyze and decode a lot of the ancient Chinese. And this spontaneous Qigong, the written record is 4,000 years. We have written records on 4,000 years status. Okay, next picture, please. Okay, and you can see, he's really reacting now. Okay, next picture, please. Okay, next picture, please. Okay, the same, I'm using anatomy now. So all the nitrogens and things, you know, trapping all the thing, you have swelling and you have pain in all the joints. So that's how we can relating to rheumatism and arthritis. Okay, yeah. Mostly is obviously is the bubble trap. So if we release the bubble, the pressure is not there, right? Just like the divers, they have such a cram in it. But once you're depressurizing it, right? Yeah, it's gone, all the nitrogens, excessive nitrogen going back into this bloodstream and pass it out. People are fine. People are fine. Okay. Next picture, please. Okay, now I'd like you to concentrate on the bottom part, the staggers. It's staggering all around the places. Okay, now quite interesting when you say that the compression illnesses may have symptoms such as an inner ear problem, okay, such as spinning sensation and deafness, raining the ear, right? Now, raining in the ears from the Chinese side is problem with the kidney, tetanus, yeah, from the kidneys, yeah. So this group of symptom is called the staggers, but from the internal Taoist medicine, you can see the cause, the balance. We talk now, we're looking at everything, heaven, earth, and human energy, okay, that affecting us. So when these people are losing balance, tumbling backward and forward, we're creating, it's like a bear, you know, in the animal, like a bear cuddling people. That's why the ancient are using that. But the balance, why? Because when you're straight, when you stand up upright, the gravity pull you down. But once you tilt, right, when your body move forward, a law of motion, if you look at the law of motion, once you're off the center of gravity, of course you're staggering forward. Or if you somehow, if you lose balance at the back, of course you're tumbling backward, right? So this is why just people using different terms and different expression to illustrate different description to talking about the 5 animals. So you can see the guy was really, you know, going forward and backward, and that is also showing the musculoskeletal blockages. Okay, yeah. Next picture, please. Okay, mark it now, please. Thank you.